Hello, welcome back. First, I'd like to ask you to please send your thoughts and prayers to Carlo and his family, as his father just recently passed. I know he would appreciate the condolences. In the first video, we were discussing the why of breathing rehab and exercising. Today, we're going to discuss the who, what, when, where, and how. Last time I left you with ways that you can assess your breathing. What you were assessing for was a condition known as BPD, breathing pattern disorder. This is basically abnormal respirations. It can range from simplistic things like shallow breaths to something more serious as hyperventilation syndrome. 50% of people experiencing stress have breathing pattern disorders. One study looking at children with asthma had found that 26% diagnosed with asthma actually just had a breathing pattern disorder. This is a significant finding, and it suggests that we are improperly medicating and diagnosing for asthma. Who should consider doing breathing rehab? This knowledge and practice is important for everyone. Anyone can have BPD. It can be acute or chronic. It can come and go like an overuse injury. This can affect everyone. Healthy athletes, injured athletes are affected. Those who have just overcome a surgery or with anxiety, asthma, autoimmune diseases, and many more. As we discussed in video 1, it shows up as increased muscle pain, fatigue, cold hands, dizziness, tight muscles, and decreases in athletic performance, such as strength, accuracy, and focus. That's just to name the few. When we talk about breathing, what muscles do you think are involved? An obvious one is the diaphragm, making up 45% of inhalation's work. The intercostals take over about 25%, and other muscles also support and control inspiration. These muscles include your serratus anterior, found over here. On the opposite side, serratus posterior, your pectoralis, your sternocleidomastoideus, and your scalenes, as well as your upper traps. For expiration, this is mainly your intercostals, mainly the internal ones, and your abs. Specifically, your transverse abdominis holds a very important value with expiration. This is often underactivated and can cause a lot of issues because of that. Other muscles in the expiration control category are your external obliques, your internal obliques. You have your quadratus lumborum, which we know if you've ever come to us about low back pain or hip issues, I've always talked about the QL or quadratus lumborum. Your longissimus and your iliocostalis muscles run along the sides of the spine and attach to the ribs in the back. These are also active during expiration, as well as latissimus dorsi. You can see all these muscles involved during inspiration and expiration have a large amount of those muscles are being utilized. This is probably why you can hear stories about yoga and deep breathing benefiting athletes. Proper breathing is your foundation to being an athletic performance powerhouse. A weak transverse abdominis causes other muscles to work harder, especially the abdominals. This is a perfect way that you would hear getting a stitch in your side or feeling the overworking abs causing that tight pain on the side. Is it really conditioning issue or is this abnormal breathing? Have you ever thought about your tongue supporting respiration? Where your tongue is positioned in the mouth is going to affect respiration and affects all aspects of health. It can even change the form of your face. Let's correct tongue position. So right now, to get a feel for the shape of the inside of your mouth, we're going to use the tip of your tongue. This may seem weird, but it is very helpful in learning how to breathe properly. Feel the back teeth with the tip of your tongue. Then slide your tongue towards the front, just behind the teeth. Right behind that, slide your tongue to the flat area just behind it. Now feel for a ridge or a bumpiness. Then go a little bit further back where the roof of your mouth or your hard palate starts to slope. In between that slope and that bumpy ridge part is where you're going to keep the tip of your tongue while you're breathing. The back of your tongue should also rest upward towards the roof of your mouth, at rest during inspiration. This might be a little harder, so what you're going to do is make a big smile and raise your eyebrows. When you do this, try to swallow while also keeping your teeth clenched. The back of your tongue will press against the roof of the mouth. Hold that spot. That's the spot where the back of your tongue should touch when you're inspiring. Practice this enough and you'll get the hang of doing it naturally. Proper tongue position benefits you in so many ways, even benefiting your looks. Higher cheekbones and a stronger jawline will improve, and muscles will be able to be positioned in the spot where they were meant to be. This will also improve your healthy bite, decrease jaw pain and neck pain, diminish headaches, and you'll also breathe and sleep better. Improper tongue positions are directly connected to mouth breathing and cause a multitude of long-term and short-term issues. Crowded teeth, for instance, so needing a second round of braces can occur. Your tongue will push forward and down in improper positions. This thrust forward will cause a gap in your teeth. Teeth grinding and TMJ, overbite and underbite, and even a crossbite from tight mouth muscles will occur. Crossbiting you may notice in the form of biting your cheek accidentally. A recessed chin or a forward thrust of the head, so your chin in or a forward thrust of the head, will also put unneeded stress on the neck and shoulders and is caused from open mouth breathing or improper tongue position. A longer, flatter face shape with vision issues will occur. What happens here is your hard palate sits just below your eye sockets. When your hard palate isn't being stressed with the tongue being pushed up against it, it starts to misshapen. That will cause the eye sockets to actually sink in, and you'll have bigger issues with vision, but also look a little different. Neck pain and headaches will be also formed. Some of you think that you can't correct this type of breathing because of allergies or worried about blocked nostrils due to congestion. But you can fix this, and it will decrease your episodes of congestion. To decongest naturally without surgeries or medication, take small, silent inhale and exhale. After the exhale, hold your breath by pinching your nose. Then what you're going to do with your nose pinched, walk until you feel an air shortage. So just a silent breath and walk around with your nose pinched, not breathing. Once you get to feel like you're having an air shortage, exhale. You're probably going to naturally take a breath in. And when you do that breath in, it can be a little bit bigger, but try to calm it down by holding your breath Just suppress it for 2 breaths longer. Then go into normal breathing and see if that kicks into normal breathing. Wait about a minute and then do this again, where you inhale, exhale, pinch, let go, inhale, and then try to control your breathing again. It is helpful to walk around while you're pinching your nose to create that air shortage. After decongesting, and this may take 5 or 6 rounds of doing it, sit or lay down on your back in a comfortable position. If you're on your back and it's painful to do so, maybe it's because you have tight hip flexors or low back pain, you can utilize a pillow underneath your knees or behind your back. That is fine. In this position, seated or lying, you can either keep your eyes open or close them. Closing them is better, but whatever you have time for. Now place your palms up. We are going to first drop into listening, as Zen Crier de Brook calls it. Mentally, feel your hands and your feet. Keep your proper tongue position and just listen to the world around you. Don't get into it. Don't try to dance or listen to music or worry about what you're hearing. Just acknowledge the sounds around you and breathe normally for 30 to 40 seconds. If you want, you can use a meditation app or essential oils to help you focus. Good. Now let's try deeper breaths. As you practice slow, deep breathing, concentrate on your belly, ribs, and collarbones expanding. This is called a 3-point breath. After a few respirations, be intentional about inhaling through your nose and exhaling out through your mouth. No worries if you yawn. Just continue to work through the technique, practicing inspiration through your nose and expiration out your mouth. If you miss a nose inhale or a mouth exhale, that's okay. Just keep trying the correct order. This is a practice of understanding. We'll discuss more about order and location of exhalation and inhalation in a second. Just practice breathing. Place one hand on your belly and another on your chest. If you can't do this because of physical issues, stand in front of a mirror or sit in front of a mirror so you can at least see this occurring without utilizing your hands. You're going to be focusing on looking at your belly and your chest. This is going to help guide your breaths, to help train the belly to first expand. We want the lower lungs to first expand out and then fill the chest with air. This rise will occur by breathing in, feel your hand over your belly come out, and then also after that, feel your chest also push out. If you are laying down, you can also feel this rise from the chest and belly, but you may not feel or notice the posterior lungs reacting. This is not really an easy situation for your posterior lungs to expand when you're on your back. Laying on your stomach, though, you will be able to better use your posterior lungs and guide your belly breaths. I personally have noticed that when I'm on my stomach, I can feel more of that belly chest rise. A wave of muscle and bone movement can be seen when you breathe. This wave is important to see when assessing for abnormal breathing, or BPD. Video yourself breathing normally while lying on your stomach. Lie straight, perfectly aligned from your neck to your legs. A good breathing pattern should form a wave from your lumbosacral area, lower area, to your thoracic region, your ribs and back, to your neck, and then out through your head. It will look similar to someone breakdancing and doing the worm. The wave should occur with deep breathing and with normal breathing. Record for about 30 seconds, then watch the video. You should witness energy move up and only up vertically. It should not leak out the sides or cause other muscles to contract along the sides. For instance, if you're breathing and your shoulder comes up or your hip moves out. It is helpful to wear minimal clothing to catch deviations on video. Your breathing pattern can be fascinating to see, especially if you compare your wave to your family members or friends. It is definitely a unique wave. Where do you notice your deficits? Think about that area. Have you had a previous injury to the area? Do you have tightness or pain in that area now? How might you correct your deviation from the straight upward moving wave? Write this info down and then consider returning to your notes after you've practiced for a couple of weeks. Even retake your video and reassess. You can practice breathing anywhere and everywhere and anytime. I try to do 30 deep inhalations and exhalations before I get out of bed in the morning. It completely changes the start of my day. I feel focused and motivated and happy, even if I'm not ready to actually get out of bed yet. But you don't just have to do these practices in the morning. When you are stressed or need more focus, you can practice at work, during a study break, or working out. You don't need to have space or time set aside to do so. In the next video, you'll learn more types of breathing techniques and when to use them. Until then, practice tongue positioning and keeping your mouth closed. Remember the order of inhalation, belly first, and review your breathing video. Bye-bye.